So I have 3 minutes after the hour. This is a good time to get started. I want to welcome everybody to this morning's ZoomCast. This is Marty Rosendale. I'm the CEO of the Maryland Technology Council and a partner with Newport. The CapitalM ZoomCast is live this morning. The CapitalM podcast is intended to further the regional conversation around capital markets, define issues, identify solutions, and build consensus to drive change in the region. Of course, our focus these days is on the impact of the COVID-19 pandemic and our regional response. The Maryland Technology Council is the industry trade association representing the technology and life science industries throughout Maryland. Together with our members, we're improving the business climate in Maryland and helping companies that save, secure, and improve lives around the globe. So just a couple of housekeeping issues this morning before we get started. I want to let everybody know that for now, your microphones are on mute during the conversation. When we get to the Q&A, there is a function that allows you to raise your hand. If you raise your hand, then we will recognize you, give your microphone access, and allow you to ask questions. In the meantime, there's a chat function at the bottom of your screen. Ann Bell from USP is on the line as well, and she will be monitoring the chat and answering any questions that come up during the discussion. So feel free to use that chat function during the discussion if you have questions that come up while we're talking. And just one final point, the ZoomCast is being recorded. It will be available for others to watch and listen to, but just make sure you know that the ZoomCast is being recorded, so anything that you put into the chat or say will be public. So again, thank you all for joining me this morning. My guest today is Dr. Jaap Venema, who's the Chief Science Officer of the US Pharmacopeia. Dr. Venema, thank you for joining me this morning. I really appreciate your time, and I appreciate everything that you and the USP are doing in the response to COVID-19.
Happy to be here, and thank you for having me, Marty.
So maybe to get started, why don't just take a couple of minutes and tell us about your background and a little bit about USP, if you would.
Sure. I'm Jaap Venema. My background is in chemistry and molecular biology. So I spent the last 25 years in various roles, 12 years in academia, doing very fundamental research in the molecular biology area. And then in 1999, I transitioned to industry, to pharmaceutical industry, where I held various roles in drug development and discovery, focusing on a diverse set of products, including vaccines, anti-pain medicines, antibodies. And I did this until 2015, when I joined USP as the Chief Science Officer for the last 5 years now. You could probably tell that I'm not a native speaker, so I was born and raised in Amsterdam, the Netherlands. And 9 years ago, we moved to the United States with my wife Esther and my two sons, Sitze and Rick. We spent 4 years in the Chicago area, and the last 5 years here in the beautiful state of Maryland. So that's. I also spent a couple of years in Germany, so I did there again in my academic time in postdoctoral research. So on to USP. USP is, I believe, a unique organization. We are celebrating our 200th anniversary this year. USP was founded on January 1, 1820. And one of my favorite topics is to go back to that time and just to create a visual. 1820, when the United States itself was 44 years old, James Monroe was president, and there were 21 states, so it was a very different time. And there were 11 visionaries, primarily physicians, who thought it was not acceptable that people could not depend on the quality of their medicine depending on where they could get them, whether they were in a different city or a different county or a different pharmacy. They thought it was a good idea to create a common set of standards to make sure that people could trust the medicines that they could take. And of course, medicine at the time were primarily compounded formulations, so really recipes of different ingredients put together locally by pharmacists primarily. So that vision that they had in even before 1820 was made a reality, and that's still what is driving us today. So USP is really committed to improving global public health broadly through programs including quality standards, but also including building capabilities, having training, working with many stakeholders to ensure that they can use our works and our services to get better quality of medicines, but also for dietary supplements, food ingredients, healthcare, etc. So that's a very brief introduction into USP. We are the USP Pharmacopeia, but we are global, so we have different sites across the world where we also have laboratory capabilities. But I could go on and on forever, but I'm sure you know, we can share more later.
Yeah, thank you for that. That was great. So first of all, congratulations on your 200th anniversary. That's fantastic. I wanted to hold this up. This is the 9th decennial revision of the Pharmacopeia of the United States. This actually was a book that my wife's great uncle used when he was in medical school. And so at the time that this was published, the organization was over 90 years old. And of course, today you're celebrating your 200th anniversary. But I show that book because I think that most people that have been in the pharmaceutical industry, the therapeutics industry, are familiar with the standards and this book, but probably that's the extent of their familiarity with USP. So maybe if you take a minute and tell us about how does USP get involved in drug and vaccine development, manufacturing, and some of the other things that you do around the world?
Yes, so you're right. I mean, one of the, so just to come back to the 1916 edition for a quick second, one of the running joke within USP is like, we're going to do this for the very first time. And then we go back to our historian and said, you know, is this truly the first time we're doing this? You're 200 years old. You have quite a bit of legacy and history and institutional knowledge to build on. And it's impressive, you know, to look at that 200 years back. But to come to your point, so yes, it's absolutely right that most companies or regulatory agencies know us from our compendia, the book, as you say, or the online edition that we publish. But we are more than that. We truly employ everything around not only creating the standards, which is an important part of what we do. We've always known and seen that it's also important to help build the training, help build capabilities, how to use the standards, but also to advocate for sound policies when it comes to medicine quality, supply chains, public health policies. So we're also an advocate for helping countries, regions, organizations build those types of policies. We have large programs that we work in low and middle income countries in regions such as Africa, Southeast Asia, Latin America, where we help regulatory agencies build their domestic quality systems with good regulations and technical capabilities. So we do quite a sort of broad swath of work to really help improve that. When it comes to the drug and vaccine industry, yes, our standards are being used to ensure that the products that are being marketed, that are on the market everywhere in the world, our standards are being used in over 175 countries, that they do comply to those standards. So when it comes to the strength, when it comes to the identity, when it comes to the purity, that people who ultimately buy and have to use those products can trust that they are made according to validated methods and standards. So that's what we are known of. We also know that we we're being used, and our products and services are being used in development areas. As you can imagine, and as we all know, the development of therapeutic products takes a long time, and there are lots of different tests, assays, developmental issues to solve during that time. And we know from working with our stakeholders directly from companies that our standards and services are used also during that time. So we have data to show that it actually can help reduce the time of development by as much as 20 to 25%. And that's significant. If you think of the number of years that it takes to develop therapeutic products, if you can shave off months or even years of that time, it means products reach the consumer and the patient earlier. And that is, of course, very important.
Yeah, that's great. And being able to shave off that time also saves a lot in cost as well.
Yes.
So maybe a pretty fundamental question here, but you talked about quality standards. What exactly is a quality standard, and how do you set them? How do you determine them?
Right. So in its most essence, it's going back to sort of the identity, strength, and purity. So identity is it what you think it is? Strength is it the amount that you think it is? Purity is, does it contain what it needs to contain, but also to make sure that it doesn't contain what you don't want in there. So impurities or stuff in there. So that's the essence of what we do. And just to draw an anecdote, standards play a very important role in our daily life, even to the point that fortunately most of us don't realize or don't have to realize. But to give a very simple example, the very fact that people know when to join, that at 9 a.m. Eastern Standard Time this webcast started, that's because we all agreed on a system how to describe time. We know when somebody says it's 9 a.m. That's the same for everybody. And we also know that that's 3 p.m. in Europe or around the world in other times. So that very basic premise of finding a common way to describe and to make sure that we all talk about the same, that's the very nature of standards. So it's everywhere in our life. And in a highly regulated area such as medicine quality, you can imagine there's a lot of attention that needs to be paid to ensuring the quality. So that's what we essentially do. How we do it, for 150 years, USP was an entirely volunteer-based organization. And now we have globally over 1,200 staff, but we still work with a network of approximately 900 expert volunteers, as we call them. They come from all walks of life: industry, academia, healthcare practitioner, consultants, regulatory agencies, and all of these together help us develop those standards. So we get input from industry on the methods and I would say the requirements and the specifications that we have to set. We convene an expert committee to essentially draft a monograph, which you can, in its most simple form, you can regard as a recipe for what you need to do in order to prove all of the things that I mentioned. We put those out for comments, very transparent. Everybody on the planet can do that, can provide comments as to whether they think it's a good idea or have suggestions for changes. And when that process is over, we move it to official. So it's still a very collaborative process. We depend on the scientific expertise of our best volunteers who come from everywhere to help us do that. In that process, we are very strict on confidentiality and conflict. So everybody who works for USP in our experts committees has to abide by a very strict conflict of interest, so that they purely reason from their independent expertise and not because of their respective affiliation.
Great, thank you. So yeah, USP joined the Maryland COVID-19 Coalition, and you're doing a lot right now in the public response to COVID-19. Could you tell us something about what USP is doing with respect to the overall response to COVID-19?
Sure. Yeah, it's been very much in our minds and with everybody in the last few months. So just very broadly, we are putting everything in sort of three buckets. One is, we, like everybody else, we absolutely want to do everything possible. Our top priority is the health and safety of our staff and our volunteers. So we've taken early measures to ensure that we do everything to provide tools to communicate with our staff to do that, and that's going on very well. The second is Many of us, I'm sure many of people on this call are also working in organizations that are trying and struggling to maintain operational. So we've taken measures to ensure we do this, because especially in this time, the world cannot go without quality medicine. We never can go without quality medicine, but our mission is more important than ever. So the majority of our staff is working remotely. We still have our labs operational in adapted schedules. I won't go into details, but it's very important. So we are able to maintain what we do, which is our mission to provide quality standards to the world. But to your question, the most important piece, of course, on your question is, what are we doing? So we are, first of all, taking steps that we continue to deliver and remain them, or have them accessible, all the standards that we create, whether they're what we call our documentary standards, the book that you just showed, but of course now in an online version to make sure that everybody can access. Also make sure that we continue to ship all our physical standards, because part of what we provide are the physical standards that companies or other stakeholders can use to order to actually perform the test that we describe in the standards I just mentioned. So that's going on very well. We are successfully continuing to maintain our shipments, our supply chain. So that is very important. In that process, we looked very early on at the start to really look at the priority of which standards are the most important in this time. As you can imagine, it's a very dynamic situation, but medicines such as analgesics or antibiotics or antivirals or muscle relaxants are very important in treating COVID-19 patients right now. And of course, we want to be absolutely sure that we do not run out of stock, that companies who continue to make these products can continue to rely and depend on us. So that's a very big piece of what we're doing. And we're monitoring this daily. We have data analysts who continue to look at signs or signals of where do we see where do we see surges, where do we see manufacturing coming online to produce more of these products, or where do we see disruptions to see how we can cope with that. We're also looking in areas of the country or around the world where we potentially see shortages of drugs, and see what we can do to do that. So that's a very big piece of what we're doing. And like I said, we've been doing a good job, and we continue to do that because that's a critical piece of that.
So
yeah, go ahead.
So yesterday when we were talking a little bit about the supply chain, and recently I had a chance to talk with the National Biotechnology Innovation Organization, BIO, and when the COVID-19 pandemic first hit, we had some supply chain issues, particularly on the diagnostics side. There was a tremendous shortage of collection kits or swabs. There was a shortage of RNA extraction kits, and therefore the country couldn't do as much testing. But because of the intense focus on solving those problems now, we're seeing those products or that supply chain issue is easing, and so more testing is possible. And Bio has been asking the question, what are the next issues going to be? And when you and I were talking yesterday, you mentioned that you're already looking at that. You're already looking at what the next supply chain problems may be. And you mentioned, with, I think I read an article, there's about 260 vaccines in development right now. And every one of those that comes to market is going to require endotoxin testing as a release test, I should say. So maybe talk about that vigilance that you're providing, and how that impacts the development process overall.
Yeah, sure. So you're right. We're trying to anticipate, and we're both in our internal thinking, but also convening our experts and talking to companies like what do you see as issues? What is coming up to try and be ahead of that curve. So to the specific point that you mentioned, so a required test for vaccine release so to release them to the market essentially is a test for endotoxin, which is a a typical impurity that is a natural part of how these types of products and vaccines are produced. So just picture the situation where over the next 2 years, hopefully, and for sure that'll happen, over the next 2 years, 5 billion doses or even more of vaccines need to be produced for the COVID-19. That's an enormous surge capacity. What we're looking at is, do we have enough of these reagents, of these products to cope with that demand once that started online? We are expecting, but of course, we're monitoring this every day, that in the July-August timeframe, that's when we will see manufacturing of potential successful vaccines coming online. We know that some companies are producing them at risk in terms of several candidates while clinical trials are going on. The true surge will start later in the year. So we're already looking at that, and we're looking at our own standards and reagents, and ask ourselves the question: what can we do to provide to make sure that that our companies can do this, that the companies globally can help us? And if we do anticipate shortages in any of these areas, what can we do to be flexible? Of course, still guaranteeing the quality and the trust that is necessary. But what can we do to be more flexible to allow this manufacturing to continue in a safe and effective way? So that's an example of things we're already looking at. Certainly, we're not the only ones who had this idea, but I think USP is in the unique position by the nature of who we are, what our organization is, to help bring together all of the stakeholders that are necessary to address this potential issue.
So yeah, it's interesting. You talked about flexibility. So we're seeing, the FDA has become more flexible. USP has become more flexible. So a number of regulatory bodies have become more flexible. CMS has become more flexible with payments. And it's resulted in very rapid development. In fact, you made a statement that I've actually used a couple of times since you made it yesterday, which is we are actually doing things in timeframes today that previously we thought were impossible. Could you elaborate on that a little bit and tell us what you're seeing with respect to the speed at which we're able to develop these technologies and products today?
Yeah, sure. I'll give an example which is a little bit outside of sort of the drug and vaccine area, but I think it's very telling. Hand sanitizers, a big topic. Of course, we all know that washing hands with soap and water is still the best hand hygiene, but there are many situations where that is not readily available, and where it's needed in healthcare settings or other settings where people do need access to hand sanitizers. So we already have guidance on this, and FDA also has guidance on this. And what we, in the same vein as what I just mentioned about anticipating potential issues around vaccine manufacturing, we saw that there was going to be a rapid shortage of hand sanitizers around the country. In this case, this has been primarily focused on the United States, but is now also being used in other countries. So we quickly put together our staff and our volunteers, our expert committee. We do have a special expert committee on compounding alone, which was the relevant one in this case. We heard of the issue on essentially a Thursday evening, and by Monday morning, the committee had finished their deliberation, put out guidance. We published this on our website, which was extremely useful. And what that did was essentially the first step was to publish 3 recipes how pharmacists or other organizations could produce hand sanitizer in a validated way. Because of course, the timelines are different, but you still need to be thoughtful to make sure that we do this in a science-based and fact-based way. So that 3-day time frame was something different for us. We've always had the flexibility in our governance to do this. But when there's less of a sense of urgencies, and when there are lots of other things going on, typically things get spread out over weeks or sometimes longer when there's no need. In this case, there was an urgent need. And in 3 days, we got it up and running, and it's still going on with many conversations with the agency, with US FDA, with pharmacy associations, with hospital associations, but also now with even distilleries and beer brewers who are stepping in to prepare these types of materials. So it's been a very unique and interesting experience to see all of this happen in a matter of days, which otherwise would not have happened. And all of that thanks to the commitment of our staff and volunteers. So this is also a moment that to express that I'm both proud and humbled by what I'm seeing with our organization stepping in and many others with us to do everything we can to protect our frontline workers.
So yeah, again, that's fantastic. And I would also commend you, your staff, all of the companies that are involved in the response to COVID-19, the speed at which they're working, the commitment and the dedication that everyone's got. I've noticed a couple of questions coming up in the chat room that are around confidence. Questions like, how confident are we in the testing? How confident are we that if we're rapidly moving these vaccines to commercialization, how confident are we in the safety? And scientific evidence plays a big role in that confidence. So maybe, since this has been coming up in the chat in the form of questions, maybe you could address that confidence a little bit.
Yeah, for sure. So we can be confident that medicine that comes into the United States and has been coming into the United States is produced according to the standards and the quality that we know, because that system is working and it continues to work, and that is safeguarded by a multitude of networks. We play part in it. We certainly are not the only ones. Like I mentioned, US FDA and other agencies and other organizations all together make sure that happens. I think the question is really about what confidence can we have now that we are working in a different time frame, that we have to respond more quickly, and does that go at the expense of all the validations? And I would say that overall, I'm still seeing a lot of what I would call thoughtfulness. So I would like to give the message that just because things happen more quickly doesn't necessarily mean that they happen less thoughtfully. So when it comes to our own operations, we continue to look at the science and the facts to make sure that we make the right decisions. It's certainly true that in a situation like this, in a crisis, that there are risk-based decisions that are necessary, because they are necessary to do that. But we have good frameworks to do that. We and many others know how to do this, to make sure that we take the right framework to take the right decisions. So I would say really a vote of confidence that we're doing everything possible to ensure that we continue to base our decisions and our services and our products based on the science and the data.
Yeah, and one of the things that I'm seeing to address this is teams coming together within the companies or within the collaborations. So where in the past it might have been one or two people in a given department that were tasked with doing the research and responding to these questions about confidence and safety and quality, now there are teams that have been assigned. So you've got more people looking at it, more minds, more thoughtfulness in addressing this. And the other thing that's interesting is these teams are meeting rapidly. Instead of deciding that we have a question that needs to be addressed, we're going to investigate it for a week, and then the week after that we're going to have a discussion, and then we'll get to a decision. Now the teams are coming together, they're investigating quickly, they're meeting quickly, and so I think your point about thoughtfulness and a continued concern about quality and safety is right on target. I'm curious, we've got 32 companies now, or actually over 32 companies in the Maryland Coalition for COVID-19. How should they be interacting with USP? And you're also a member, and so you're interacting directly through that collaborative process, but how should they specifically be interacting with USP?
Give us a call. I would say. but that aside, I think the first, I think, and I was on a call a couple of weeks ago where we started talking about this in the context of COVID-19 response, and I think it's very gratifying that we're seeing this at all levels. What you mentioned, like teams coming together, working with a great sense of urgency. I would say that's also at the level of organizations and companies. I think you, Marty, yourself wrote a couple of pieces about how we see the effort moving from a competitive space where, of course, with 30 companies, in some way are competitors, but we also see this moving towards a collaborative effort, which I think is really great to see. So in terms of interactions, it's first of all, operationally, it's fairly simple. We are an open organization that is ready to talk anytime. So we don't have any walls, no borders to get in touch. So that's easy, and we'll certainly be able to share our information, whether now or after the call, to do that. And really a call to the Maryland area, to the companies that we know work us to start the dialogue. We do not pretend, and we cannot pretend that we are aware of all the issues and the technical issues that we can help solve, or whether there's anything else. We can certainly, like I said, anticipate and think about what might happen, but it's impossible for us to look in everybody's kitchen to know what's going on. So that in itself would be very helpful to share that. And then in our unique role of convening, being an independent nonprofit organization, what we've done, again, coming back to our history, but also our future, what uniquely positions us is bringing people together, bringing organizations together. When we hear from one company that they're struggling with, hey, how am I going to do this? It costs me too much time. Can you help me? When we start hearing this 1, 2, 3 times, the value is like, hey, we're hearing this more often. There's a real value in bringing people together to solve this together. That's something that is, I would say, more difficult to do at the individual company level, because you simply don't have the time, and I imagine, but also you're busy doing that own work. So that's a unique skills and expertise that I would say USP brings to the table. And also having a global reach, working with regulatory agencies, stakeholders, industry worldwide, we can certainly help connect them. So that's my primary message to any company in the area, and we are doing this. To your point, we are talking with individual companies, also at the level of the Maryland Tech Council, to ensure we do that.
Great. So Jaap, I'm going to ask you to get your crystal ball out for a minute, and in your vigilance over the supply chain, are you anticipating any vulnerabilities in that supply chain, whether it applies to vaccines and therapeutics for COVID-19, or therapeutics and such for other important conditions?
Yes, we are. So the crystal ball doesn't say like, don't ask me to predict that's going to happen, or that piece of the supply chain is going to work, but yet for sure. So coming back to what I mentioned in the beginning of the call about monitoring the data. So I'll give you a few examples where we saw manufacturing, even through the sales of our own reference standards, which is a very early signal for us to see what is going on there. So we do see a surge of standards in areas like analgesics and antibiotics. So we know that there's more manufacturers coming online. And we know that then when that happens, when those companies are sourcing their ingredients, whether it's raw materials for the production of these medicines, or even to the point when it's packaging or distribution, we know that could lead to potential disruption. So that's one area we're continue to closely monitor. But coming back to, or maybe expanding a little bit on the packaging, when vaccines are going to be used in, hopefully as many of those as we can, there are going to be challenges to the system, how to distribute, how to package, how to store them. And again, that's something that we believe we can be helpful in providing guidance or technical documentation, or even advocating for good policies. So that's something that we see in the short term that we're monitoring. So we continue to see that. We are seeing temporary shortages of materials, both in terms of the drugs that I mentioned that are heavily being used in areas that have been hit hard by the pandemic, but also in personal and protective equipment of healthcare workers, masks, garbing, gloves, etc. So those areas continue to be of a major concern, and to be sure that we address this. I would say taking a slightly, I would say, longer term look, this is also a time when we continue to advocate for building resilience into the supply chain. So to make sure that we continue to do our manufacturing and spread those geographically around different areas of the world, so we can no longer are dependent on one or two specific areas in the world that would manufacture the majority of certain types of medicine, as we are seeing now. So that's an important aspect to make sure that we advocate for, I would say, more control, more oversight, more testing into the different streams, more transparency, where products are coming from, where materials are coming from. So I know I'm mentioning a lot of these things, but that's something that is on the top of our mind. And we certainly hope that both in the short term, when it's addressing specific issues around COVID-19, but also taking the lessons learned and hopefully as a society and perhaps as a world to really take steps and measures to be prepared and to do this in a better and more resilient way.
Great, thank you. Is there anything this morning that we haven't covered that you would like to cover before we go to the Q&A?
I would say, I think we covered quite a bit, but maybe just taking off my USP hat and just taking a personal hat for a second. Of course, we all know that we will be able to overcome this pandemic once a vaccine comes online. So this is a time when there's a lot of uncertainty, there's a lot of concern, both at the personal level, but also at the organizational level. 10 years ago, I was working in flu, in H1N1 and the swine flu when we had a similar experience, not quite as devastating as this one. I just want to express my hope that we continue to work together and to collaborate to do everything possible that we get out of this awful situations together and rise. Great.
Yeah, thank you for that. I think there are so many heroes that are coming out of this. I mean, your staff, the members and the employees of the collaborators in the COVID-19 coalition, first responders, our nurses, our doctors, even the grocery store workers that are keeping the grocery stores open. It's just an amazing number of heroes that are coming out of this and demonstrating what we can do when we all get together to solve a problem. So I think that's just amazing. What I'd like to do now is open it up to questions. And so there should be on your screen an option to raise your hand. I see we have one person that has raised their hand already. It's Jaap Venema. I presume most likely a family member. So I'm going to unmute and allow the question. All right, Willem, you should be able to ask your question. No? Okay.
I can FaceTime him afterwards.
Okay. Do we have any other questions from the participants this morning? No, I think Anne has done a great job addressing questions as they have come through the chat. So we've probably addressed most of the questions that way. And again, a lot of the questions that I saw, Jaap, had to do with confidence in testing, confidence in vaccines,
Mhm.
and I think you addressed that. Uh, but having gone through the mid '80s when HIV and the HIV crisis was at its peak, there are
Mhm.
a lot of people that are afraid, and they're looking for that confidence out there. And so I think that it's the scientific evidence. It's getting more people educated about the work that's being done. Is there anything that you'd like to add with respect to that topic?
Yeah, maybe to so yeah. I mean, um, on behalf of USP, but also so it's about trust. You're right. It's about building trust. And I'd just like to give an anecdote that I hope will give the confidence. So let me ask you this, Marty. The last time you went to a pharmacy to buy a medicine, maybe an over-the-counter, a painkiller, or something like this, have you ever had to wonder or to question like, what is it I'm getting? It's like, have you ever worried about? I'm not sure about what this is. Um,
Yeah, I'd say that I have. I mean, the pharmacy offers an opportunity to consult with the pharmacist, but
right.
unless you're a pharmacist yourself, you may not have any idea or understanding what's actually in that pill bottle that you just picked up.
That's right. That's right. And we can expect that the 320, 30 million people who live in this country, and of course the many billions across the world, know all of this. So part of what we do is we are part of that system, that safety and quality network, that people can rely on, so that when they go to the pharmacy and get a prescription or buy an over the counter, that they can rely and trust that it's the right quality, it's the right strength, it's the right identity. So that system continues to be in place, and we'll do everything, and we are able to do everything to continue to uphold this. And that's an important message when it comes to the medicine quality, that we are committed to continue to do this and to continue to play our part. Again, I don't pretend that USP is everything. We are not everything, but we are an important part of that system, and we are committed to maintain that.
So, Jaap, I see a question that just came up in the chat room, and the question is: Does USP only provide standards for human medicine, or do you also get involved in veterinary medicine?
We do. We actually have standard for veterinary medicine. We have a staff and also committee, so we do have that. So it's not only it's the vast majority for sure, but we also have a standard for veterinary medicine. Yes.
Mm-hmm. Great. All right. Well, I don't see any other questions coming up. So, Dr. Venema, I really want to thank you for your time this morning. And again, thank you
Pleasure.
to you, your staff, the USP, for everything that you're doing. It's been a pleasure talking with you. I know we'll get a chance to talk more since you are a member of the COVID-19 coalition. So we'll have future opportunities. I want to thank all of the participants this morning for joining us. At the peak, we had over 60 people on the line. So there's certainly a lot of interest in the topic and the work that you're doing at USP. For those of you that joined us this morning that are not members of the Maryland Tech Council, I would encourage you to take a look at our website at mdtechcouncil.com and consider joining. Again, this has been the Capital M podcast, now ZoomCast Live, and our focus is on capital markets and now more intently on the COVID-19 response. Dr. Venema, thank you so much for your time this morning. Really appreciate it.
Thank you very much. It was a pleasure.